Hello, my name is Unessay. Today I'm just going to do project on Unessay and I'm just doing podcast with my friend for this assignment, and the topic of my podcast is how social economic status affect the healthcare. Because in the society the social level is divided into high level, low level, middle level, and it also affect in healthcare sector. So that I just want to explain how it affect in the society, how it is doing, and how it goes everything with my friend. And I think health is a crucial thing, so that it must need to be free worldwide. Like, you don't have to pay, you don't have to think, and health is not determined by a social status or the position what you are actually in. I just think like that, and thank you, Professor, for giving me this opportunity, which I want to explain and I want to say for so long through the podcast. And I'm just going to begin.
Hi guys.
Yeah. Okay. What do you think that does social class influence the persons to assess the healthcare?
Yeah, of course. Like social class, like the income of the people, like it affect the like person
I think
access to healthcare. Yeah,
I agree with you. Like social class affects very affects the income, educations, and occupations, what kind of job the person holds.
exactly.
All those factors affect the person access to the healthcare. Because if the person have the high level of income, he have the different lifestyle, he will get the treatment like that way. It's basically determine what's your position on the society.
Like the status and the maintenance you have, like taking like care of your family and how you are like going through, like everything matters.
Likewise, there is the various facts that low socioeconomic status also affect the healthcare outcomes. Like the person who have low level of income, they will not get that kind
like
of
they
treatment.
can't afford the kind of like
private
health
insurance,
treatment, like everything they like have to like book the appointment and they have to wait for it, and like the balanced diet, the healthcare, everything, like they have to like they have to like keep
low level,
according to their
low
like
level income family might skip the regular dentist visit due to the low cost. That's the example.
And also due to like their busy schedule, they
and
don't
they
have
will
like
go
enough
to the
time.
hospital when they have the very emergency case. Otherwise, they will not
only
go for
in the case
first,
like they are like
dying
or like
do or die,
unwell, like at that situation. But yeah, we have to like check regularly if you like, we have to like, we want a good health care, but it's not affordable by every person. And also the situation,
I think education also play a role in health issues, because the person who are kind of educated, they can communicate with the doctor properly, they can understand what's going on in their life.
Also like educated person understand the importance of like vaccine. We have to like the vaccine, we have to like apply different kind of vaccine, or also all
the time and
mental health counseling, everything. So the educated person understand this clearly, but the person who are like not like really aware of those things, they think like it's not that necessary.
They are just trying to skip
from the things because they don't have the knowledge, like
and even if they have the appointment, they will not go for the regular counseling or the regular checkups, follow up. If they are fine for the right now, I think I don't need to go to the like my grandfather used to do like that. Even though my family said he is not that much educated or something like that, he said I'm okay right now, I don't want to go in the hospital.
Even my grandmother like used to be very sick, she like it's the condition to go hospital. In that case also she be like, no, I don't want to go hospital. I will be fine by
Yeah,
tomorrow.
even, I
Give
don't
me
know,
hot
they,
water.
they,
Yeah.
they are really afraid of sirens or something like that. Or, no, I don't
No.
know.
And also
But-
in our country, Nepal,
Yeah.
there is nothing like follow-up regular checkup. People
There's
only-
no whole body checkup.
We are
yeah,
also
some-
morely talking about our country, not the United States. We know like United States people like they go for regular checkup.
They are more educated compared to our country. Even though my grandfather has passed away right now, that's this very sad news. But he does not want to go hospital when he was in the last stage of his life. Like he have to go hospital even though he don't want to
They are
go.
so aware about this. Like we have to go regular.
Yeah.
Even if not that cases,
Yeah.
even though they are extremely unwell, they need to like consult with doctor. At that cases also they be like, no, I will be fine by tomorrow. Give me some medicine. I will be.
Yeah.
That doesn't
And
work. Like
even
that.
though here like health insurance create inequality, because when we have some kind of chest pain or something like that, we can't afford going hospital all the time because it's so expensive, right?
Yeah,
So
of
that
course.
even the people are educated, they just try to skip going because money play a role, you know.
Yeah. Our
Yeah.
friend Monique,
Money play a major role in the society, and if you have the insurance, then you willing to go that I have to go. But otherwise the normal person like us also try to
we
skip.
also like try to skip because we
Yeah.
don't have like
That much
of
money.
sufficient money to afford everything.
Everything.
So we will like we are fine.
Once we reach to the hospital, they will just ask $200 something like that, and
And
even
we
though
are
we do have insurance.
and we are a student, and
Yeah.
that is like huge thing for us.
And living in urban area versus the rural area also affect the healthcare.
Of course, like in
Living
urban
in the
area-
United States and living in Nepal,
Nepal,
also.
there is like it will be like perfect example in our like area or in our country. There are hospital, but those people who are towards the rural side,
villages,
villages,
over
they
here
they
also,
have to like walk, or the hospital are far, and there are like even though there are some kind of small clinic, there are like not that much like
even
of
though here
facilities.
in the Vermilion, even though it's the United States, it's a very very small town, you know.
Yeah.
And there is no major hospital. There is one hospital over the farm, but even though it's kind of the open heart surgery or something like those kind of the big heart attack, it's kind of complicated to get treatment over here. Like
So,
here it's
yeah.
also not that much because it's the rural area.
And those
And-
city hospital, we have to like run towards the city hospital
Yeah.
for the like better treatment.
It will take usually 1 and 2 hours, and when people are just
very,
like to be die or something like that in the very very emergency situation, when they are traveling they will die, you know.
Yeah,
that
like emergency cases.
yeah,
It
in the
will be like
emergency
that, yeah.
cases. So that I think rural area has that complications, and that's problem. When the urban area, they have many more hospitals, like in 5 minutes distance there is one hospitals,
Yeah, that's
so that it also play a
huge role.
huge role. And employment type affect the healthcare access. Like full-time job employers get kind of full coverage insurance, like part-time worker never get
No, they
insurance
can't.
coverage or
Yeah.
something like that, paid leave or like that. When the people have full-time job in well-established company, they will just get the insurance, they will get the paid leave, so that people is willing to go to the hospital. When people are
But
just
like
working in the gas
part-time, yeah.
station at the
Yeah.
part-time, they don't
At
have
the
the
restaurant.
insurance. Yeah.
And also they have to like they be like they wait even though they are sick, they be like, no, I have to go for work. Like,
Or yeah,
that
they,
be also
because
the
they are not
cases.
getting the paid sick or something like that. Because if they don't work, they will not have money to pay the rent or something like that, so that they will just try to escape. I think
Yeah, it's
employment
true.
type also affect the healthcare, like, and poverty increase stress and impact health. Like when people don't have the money, they will just think so much how will manage, how can I manage these things, how can I pay the installment, how can I pay the
like
insurance,
everything they
and
like
it
hectic.
will create
Yeah, like everything like mess around their mind, like I have to do this, I have to do that, and at last they will be like forget about their health. Like health is most important, but people after like counting here and there and like calculating this and that, they will forget at last, and at last we
they can have the chronic stress, and
yeah.
it can affect them. And what do you think, what are the ways to reduce healthcare inequality?
So I can't like, I think firstly like we have to mostly focus on the education, like providing like we also like we self should be like we will be like willing to like get the everything knowledge and information regarding to the health, so we can be like aware like what the vaccines play roles in like every trauma, and those the health preventive measure, the regular checkup. So firstly we should like more focus on the education towards the health sector.
For me, I think government and communities also focused on the healthy insurance. They will mostly need to do free treatment. Like if they have in the European countries, most of the country has, they don't need to pay money when they went to the hospital because it's free, so that people wanted to go hospital immediately if they happen something like that. This kind of rules need to implement in each and every country, so that people can go to the hospital and they don't have to think about money. And they should do the awareness program mainly, like free vaccinations in the clinics when they have the low incomes, something like that. If they just go and run through that, then it will be easier,
much easier for the people like who can't afford like the higher treatment. So yeah, government should be like more considerate about those things, so that like people will be like there will be like equality in the health sector.
Likewise, housing also play a major role in effect of healthcare and access. The people who are rich, they have highly maintenance, they have the housekeeping cleaner staff to clean the house every time, they have their personal space, they can use everything by their own, and they don't have to worry about anything. But the person who don't have that much income, they need to exist in a small building, many of the people. And I think when it is crowded, almost people is using the same things, it will get the infected, it will transfer the diseases, and it is also create a problem when like you do have the asthma,
like in a like the big family with like small kind of like house or something, there will be
breathing problem, asthma, something like that, the like disease which are transferable.
Also there will be like not the proper maintenance and cleanliness because of like large number of children and the busy schedule of the parents, like those things affect on the like healthcare.
And
also
I do have another question also, that how does assess healthy food related to the social class? What do you think of that? Like, does the high income family usually have access to the fresh fruits, veggies, organic foods?
Like the thing is like highly like high standard people be like they don't eat the like food, leftover food, and also
they will just go over the organic fresh
and like
which are healthy, which give protein.
Lower class people or like the middle one, they be like we don't have to like waste the food, and they will store the food for like several days. So those things also, and also they can't afford
and
that kind of diet, and
diet, and people who suffer from the malnutrition or low nutrition, those kind of things, due to the social class. how does discrimination related to the healthcare access? Like sometimes people from the lower class or minority background may face the discrimination in healthcare settings. This can reduce the trust in doctors and hospitals, that they will just do the discrimination among the rich and poor people. They will just behave like that. And sometimes I see,
and also the case is like whenever like the doctor, if the doctor is not focusing on the people, like after that the people will be like, he's ignoring me, like he's not taking my thing seriously. So why would I like go to check? Like that thought will be like also on the like patients,
and they will avoid the treatment.
They will avoid the treatment.
Sometimes I see back in the home country when I just go to the hospital, there is hospital barrier. The person who want to go, who is rich, who can offer the charter helicopter or something like that, they have the high level of hospital. Like it seems like very good inside the nurses and everything. The person who work in public sector, they are such a rude person that they don't want to speak properly, politely. And in this case, the people who have not sufficient income or the high class income over here, they can't go in the private hospital and invest all
the thing
one month.
Is like in our country, like we know there is a lot of corruption, and still people are like the people like us, the Gen Z, are still fighting for this. And lot of corruption, and they prioritize the higher like income people or the high standard people, and they avoid the like lower standard people, even though like those,
they are already in queue for the treatment. They will just go through the high level power.
One call, they be like one call, and I will be like I can go first. Like that kind of thought is there in our like country, and we are we are here, we can't do anything. But like people like us, like the Gen Z, are fighting for this. I think this election may change something, so our country will be like
and I think transportation also played a major role, like in the healthcare, medical care. If you have your own car, then you can just go by yourself by driving or something like that to the hospital when you do have appointment. I do have appointment today actually, but I didn't go to the hospital because I was tired.
And
I was tired from the work. I do have work today. And then after, when I just went to the gym and I came back, and I realized that I have to walk so long from here, and I was so tired. I don't have my own car, so that I have to cancel the appointment. It's my stay tired.
So
and most of the people,
like
early patients who live far from the hospital, who don't have the car and who just miss the public transportation in the exact time, they will frequently miss their appointment.
They will miss cause due to the accessibility and the like transportation.
Those all the factors is related to the money indirectly.
Indirectly, it's like related to the money stand.
Okay, social support affect health outcome. We are talking about that. And people with the strong family background and community support usually have the better health outcomes, like emotional and financial supports can help people a lot about
seek for the help and care when they need it. And it's very important like how the connection we are making with the like the neighborhoods, with our friend, with our family members. So this is also much important. So at the time
when you are connected around the positive environment, like when you are surrounded among the positive friends, positive people around you, it will encourage you to do the good things.
Also, and we can get help. We can get help when we are in a like need, and they can support us like emotionally, maybe financially.
When we are stressed or depressed, they will just like help us to counsel us and just motivate us to go through the counselor or something like that.
So that it's very important, like how we are making connection.
I
with
think
everybody. Yeah.
society and the people whom we surrounded also create a major role, because if we are not surrounded by the people who don't think good of us, they will just make us so stressed.
Yeah, right.
And I think social economics affect mental health service also. Like mental health service can be expensive, like therapy sessions may not always covered by the insurance, like highly
Like people with
psychiatrics. Yeah.
low income can ignore like mental health problem because they cannot afford counseling, and
Yeah.
counsel is very expensive. We have to like follow up for regularly.
Yeah.
And it's also like it also be like taking our time, our
Yeah.
investment.
Yeah, even though
Even
the
though it's
country.
needed, but for some people who can't afford like the higher
Yeah.
counseling, like the daily counseling, that will be like difficult for them.
Yeah.
And yeah, so
And the people from the country like us who is still developing, they don't even know that mental health is also a problem. Like people can suffer from the depression, anxiety. They think this subject is a soft, like
so like it is the tensor, it will go,
yeah,
it will go
how
away.
can you suffer from the depression? Everything is good for you. They will
And
just
also in our country, like they treated depression as like mental, like the mentally
disabled
disabled
yeah.
people, like the people who are like what they mad or something like
Yeah.
that. They also call the things depression like this, but depression is like very serious topic. The depression, anxiety, the mental health problem is like, I think it's very very like,
so that the people
serious
who
topic.
are in social economic status, who are the high level people in their family, they can understand that easily. The people who are from the country which is backward still, or the society which is backward still, they don't think the anxiety, depression and such other diseases is still a problem, or it is still a disease. They just think is they are acting, or they are just thinking and creating by itself themselves. They are creating the problem by themselves. It's not a problem, but it is a problem, guys.
It's a huge problem, and we have to like take it seriously, neither neglecting or like ignoring it.
Yeah, and another thing is that childhood socioeconomic status also affect the future health. Like child who grown up in a poverty, who don't have sufficient food to eat, they are suffer from the poor nutrition, limited health cares and stressful environment. They will always suffer from the physical and mental
Like
health in adulthood also. They don't
like
yeah.
the children who are not getting like the proper vaccination,
Yeah.
nutrition, like this will affect on like on the future, like at the later they can suffer with like some like serious kind of diseases or some health problem in their
Yeah.
life. So we have to like sincerely like take care of like children nutrition, their hygiene, their sanitation, everything, so
Like,
that
yeah.
like it will be like good for their future.
And the people who grown up in the high level of family, they just grown up with the proper nutritions, diets. In the some of the richer family, they just hide the nutrition in the home just to cook the food
and it's
according
good
to
for them because they can afford it. But the people who even though they are trying, they can't afford those kind of
food
like
also,
high things. We can't expect that, but also the food, the proper vaccination. So like government should be like be responsible for that, because
for the basic needs of the people.
For the basic needs of people. So
especially in the case of health, they don't need to do the treatment or something other things like food, health, transportations. Those are the bare minimum things.
And so also I think that we have to like take children health very seriously, because they are the like future builder of the country, of the nation. So those children should be like very healthy, and they should think mentally, their mental health, their physical, everything should be like take seriously, so that we can generate a healthy and a like good future ahead.
Future ahead. The people, the country, like some of the countries in Africa, the people are dying just because hunger. The hospital and other things is so far.
Yeah.
Hospital and healthcare is the far things. They don't even get the food to eat.
Some
people eat sand, and some people eat the garbage
on like social media, and it's very disturbing to watch. Cause
it's
people
very
are
painful, actually.
Painful, and also like very emotional. Like they are eating literally a sand made like some kind of like they call, I don't know, like they call it biscuit, sand biscuit, or like what is that?
Yeah.
It is made of like made, and the
because
the
in that situation there is no hygiene, there is no healthcare, even though they are not getting the food.
Yeah. And I don't know what the government is like doing over there, and they can't even like like they are like crying for only for the one time meal for a day, and that's very.
And I'll ask you the last question, okay? Can universal healthcare reduce inequality? What do you think?
So like universal health system have like aim to provide like medical service to everyone regardless of income. So this reduce financial barrier first of all, and for example in like many countries with universal healthcare, people can like visit doctor without worrying about high medical bills. So I think it's a like very huge thing. If like these things will be like happen, then the financial problem regarding to the healthcare will be like reduced, and there will be like equality on the healthcare system. So I think it will be very great if those things like they run gradually.
Yeah, that's the things. And and another thing is that healthcare is a basic human right. Not it is not a privilege or something like that. In my opinion, many people argue that healthcare is the basic human right because everyone deserves medical treatment regarding the income or the social class. It didn't matter. Health is the essential things in the people life,
the survival
and the quality of life.
Yeah.
And some people argue that if there is the free of the medical things and other stuff, people is going hospital regularly if they are not being suffer from the things. But in every aspect there is advantage and disadvantage. But I think healthcare it must need to be free, and it should not be determined by the social class or status. I think that.
Yeah, it's true.
And what do you think that how cycle of poverty connect poor health? Like, the cycle of poverty means the poor health and low income can reinforce each other. So when people is sick, they miss work or lose income. They may miss their work or lose incomes. Without income, they can't afford the treatment
like
and
health, and it like gradually be like affecting towards their health, because if they don't go to work, then they can't get the money, and they can't get money, then they can't
buy
get
the
proper
medication.
health care and the medication, everything. So it's like cycle of poverty. Rather you do this, you are still getting a poor health. If you are working hard, also you are getting like a poor health. Like it's ending towards like the same things. Like the poverty is on the running cycle. It's never ending.
Yeah, that's true. And we are just coming to the conclusion that how does cultural belief interact with social economic status in healthcare? Like cultural belief is something that might affect people's view, illness and treatment. As we said before, that in our country people think anxiety, depression is a different things.
Yeah.
They don't think it is a disease and we must need to treat it as a disease. Like they will sideline the people who just suffer from those kind of things. And when we combine low socioeconomic status, this belief may further health access or something like that. For example, some communities might rely on home remedies instead of the medicine and doctor appointment.
And
like some people just believe in some kind of even the religious aspect also affect those things. The people who are Christian, they have different philosophy, like religion belief of the diseases it can be go through this. And another, like in the Hinduism, the people just believe in tantric or something like that just to get out of that diseases, and it is not the good things. And I really want to say at the conclusion and in the last moment that we should focus on health. Health is very essential things, and social status, social class, it didn't matter you are the higher income people or the lower income people, health must need to be free, and it is the most essential things. Without health is nothing. You can't work, you can't study, you can't do anything. So that government should need to focus on those things, that for the basic healthcare, it must, for the basic or higher healthcare, healthcare must need to be free. Due to their job, due to their social status, and everything should not affect the people's health. Yes. That's the conclusion of my podcast, and thank you, Professor, that I can explain what I think, because for me, when the country where I am from, over there the healthcare is not that much expensive compared to the US. We can't afford anything over here, like in the term of in the term of medical things, it is so expensive. So that government over here must need to focus on healthcare, and they just try to give the person the best health in everything, even though they just have the lower income, or it should not determined by the people it status. Thank you. Have a good day. Bye.